beautiful, 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 beautiful angel.
Technique do you use? Do you always cut around the front of the ear for
So
the lower facelift? Is that the technique every doctor uses? That's where you pull from?
So normally the pull is not just a skin pull, but that's actually more of an access point, if you will. Because
But
if
you're
you
pulling
just
muscles?
right, because if you're just tightening skin, you may look nice for maybe 6 months because of swelling that's there. But what has to be done is you're making that access point so that you can tighten the muscle underneath.
Well, that's important for underneath because I know the platysma
Pisma.
has to be tightened. It's like a canvas. It's like a sling, isn't it?
It's a sling,
It's
and
a
you can
sling for
tighten
your
that
chin.
sling. And so that sling can be tightened again by stitches placed in between it, like, and going back and forth like a trampoline, or stitches going back and forth along the jawline, or even from, again, the incision here, pulling it. And so there's a lot of different ways to tighten that platysma muscle.
Now, for girls who have longer hair, you don't see that. But what about the short-haired girls or men? How do you make sure that that line isn't a dead giveaway? Because that line I've seen on people, be sitting next to them, and I know for sure they had a facelift.
Years ago, in Michigan it was founded, there was a procedure called the lifestyle lift. And the lifestyle lift people would have, and it was a fast procedure. People would get back to their activities quick as well. But what happened with many of these people is that the incision wasn't hidden. So the doctor would just make a quick incision in front of the ear, behind the ear, tighten skin, tighten muscle quickly, and then suture things back up and send them on their way. But what would happen is this would pull and would leave a scar line for them.
Or it affects the lobe.
It affects the
Their
lobe. The
is
lobe
like
gets pulled down.
pixelated. Is
That's
that
correct. It becomes
yeah.
a pixelated ear.
Right, I've
And it
seen
gets
that
pulled
too.
down.
Not attractive.
And so when I'm performing a facelift, I take almost an hour just to hide the incision itself. So where these doctors were performing the procedure in an hour, the whole thing, I'm taking an hour just to hide it. And so I follow the natural curves of the ear.
Do you go a little inside?
You
so
go a
it
little
doesn't
inside the
show
ear,
on
that's
the
correct.
outside?
Yeah, so you have to go at those angles, and there are certain tricks that you learn over time to hide the incision. So I invite everyone to go to my website, come in, take a look at the pictures of the facelifts. It's near impossible
To see?
to see the incision.
Because I've seen.
Want to see and learn more? Well, you can watch the full episodes with Dr. Mark Berkowitz and Jackie Kallen by searching Accent Your Beauty on YouTube or by going to newradiomedia.com, where you can catch our newest episodes every Wednesday night at 7 p.m. Eastern Standard Time. Be sure to like, follow, and subscribe to our social media pages to keep up to date with our tips and ideas on how to be the more beautiful you. Links in the post above.